So I know Tino did not get to show us how to create a bow tie, and I've actually successfully created 2 of these now. So I wanted to create a video showing you how to create that type of question. So I'm in our sandbox. I've already created one, so this is going to be an example number 2 that I will delete later. So you're going to click add a question, and you're going to do fill in the blank. So the NCLEX actually does not give them much example or much description on the question, because what they want them to do is read the scenario and then fill it in. But I think for now, I'm going to give students something similar to this. You'll complete the blow tie layout to determine the most likely condition that the patient is experiencing after reading the scenario, the appropriate actions to take, and the parameters to monitor. Complete the diagram by selecting the appropriate choice or choices in the drop-down boxes. But you have to create these drop-down boxes. So to do that, you would click Insert Table. So we're going to click there, and you need 3 columns, okay? Because we need 3 columns to determine actions to take, condition that the patient is most likely experiencing after reading the scenario, and parameters to monitor. And we need 4 rows because we're going to have 5 drop-down boxes, but you want a title row. So we're going to push insert. So here what we're going to do is we're going to title it so you can actually directly type into these boxes. So to do that, you can just move your cursor. So we're going to do actions to take, condition most likely experiencing. I can't type and talk at the same time. And parameters to monitor. So now I have the headings for what I'm having the students look for. So now I've got to add a drop down. So my first drop down is going to be there, my second there, my third there, my fourth there, and my fifth there. Okay, this is very important as to what order you put these in, and this is the order that NCLEX does suggest we put them in. So our answer choices would have to align with what we're asking. So don't do 2 actions to take right here, because actually the second drop down is a parameter to monitor. So it does change how we put in our answer choices. So my scenario is actually about a UTI patient. And so I would do number 1 on actions to take. I'm just going to make up some here. So start an IV, initiate 2 liters per minute oxygen. And let's do the third as obtain a urine sample. Well, if it's a suspected UTI patient, I want a urine sample, okay? But that's number 1. Actions to take, I want them to notice that if it's a UTI, I need a urine sample. So then my second box is parameters to monitor. So in this case, I would want to monitor urinary output. I would want to give them a choice about serum glucose level. And I'm going to explain why I chose that in just a second. And heart rhythm. So I put a serum glucose level here because actually my number 3 on condition most likely experiencing, one of my distractors is DKA. One of them is going to be the urinary tract infection because that's the correct answer. And the other one's going to be atrial fibrillation, which is why I have the heart rhythm as a choice up here. So I want urinary output. So my distractors are going to match some of my actions to take. So the correct answer is a UTI after you read the scenario, urinary output, and obtain a urine sample. So far I have an answer and choices for 1, 2, and 3. So now I need to go to 4, actions to take again. So my next one might be all related to orders. So I might ask for an antibiotic order. I might ask for IV fluids or anticipate antibiotic order. Maybe I want to do that instead. So anticipate start of IV fluids. All of this depends on what course you're teaching and how you're asking and what you're asking in the scenario, obviously. So in this case, it's a UTI, so I want them to anticipate antibiotic order. Now, number 5 is parameters to monitor. So it is a UTI patient, so I might do temperature, which would be my correct answer. If it is a DKA patient, I might have them do ketones as a distractor. And for atrial fibrillation, I might do pulses, so femoral pulses. I'm just making up something there. So now I have an answer choice for number 1, actions to take. I want them to get a urine sample. I'd want them to monitor urinary output. I want them to suspect UTI. 4, I want them to anticipate an antibiotic order. And 5, I want them to recognize they need to watch temperature because it is an infection. Okay. Now the last thing it is nothing up here tells the student the scenario. So I need to do a drag and drop or click to attach a file. So I actually have a file and it is UTI or scenario. I think it's under scenario. So I want to click scenario for BowTie. So that just added, and I had typed that out. And so now I'm going to show you that process. So what I did was I typed out just on a regular Microsoft Word document, I typed out a scenario. And it's about a woman with a UTI showing some signs and symptoms, blah, blah, blah. So once I did that, I went down into my black bar at the bottom of my computer, and it says type to search. And what I did was a snipping. So the snipping tool on our new updated computers no longer works. So you need to do snip and sketch. So when you do snip and sketch, it's going to pop up something like this. So you're going to click new, and you're just going to drag and highlight something very close to your font, and then you're just going to save it and save it as a PNG or a JPEG or some kind of image file. Once you have it saved, you would then put it into this drag and drop just like I did. That's very important because that's where it tells the students the scenario in which they're supposed to be completing the BowTie. So now we're going to push save. If you do anything wrong, it's going to tell you. So now I want to show you what this question would look like for the student. So the scenario is up here. So when I do the attached file, we want to check to make sure it's there. You can actually see exactly how they see it. So that's what their scenario would look like. And then these boxes, again, are the drop down. So they would click and choose the correct answer from the choices. Now, these can get really long and confusing because the students would have to scroll. So the more choices you put in these actions to take each drop down box, the more scrolling and confusing these questions can be. I hope that this helps. And again, it took me, with explaining and showing you everything, about 8 minutes to do this question, but the first time took me a whole lot longer. So I didn't want y'all to have the same trial and error that I had. Let me know if you have any questions.